The first question we have over here is this one, very nice question. What, this patient has some rashes. If you can appreciate this picture over here, this patient has some rashes. What do you call this condition? If I show you these rashes, like the scaly lesions, what do you think? Any problem? I think you can got this, the scaly lesions. Very important. This is ichthyosis, which are like fish-like scales. In this condition, you can give coconut oil. So some people, students will say this looks like a phrynoderma or a toad-like skin. So this is fish-like scales known as ichthyosis. How does phrynoderma look like? See, phrynoderma, why it is not a phrynoderma? I know phrynoderma is a toad-like skin, but why it is not a phrynoderma? Because this one is not spiky and phrynoderma is spiky. If I show you a picture, this like a toad-like skin, this spiky thing, this is known as phrynoderma. This one, like a toad-like skin, like a spiky thing, this is phrynoderma, and this one is not spiky, and this is ichthyosis. For this, basically only coconut oil will be more than enough. Now, next question we have over here is, yes, these all are our patients only. A 4-year-old child came with complaints of angle of the mouth, is having some kind of things like that. What do you call this? This is known as angular stomatitis. Angle means angle of the mouth, and itis means inflammation. So there is an inflammation of the angle of the mouth. So angular stomatitis. Basically, in iron deficiency anemias, in multivitamin deficiencies, you have this problem. So either you can give a multivitamin syrup, or you can give an antifungal mouth paint for local application also. So this is like a broad finding seen in many anemias. Angular stomatitis, cheilitis, all these are common in nutritional anemias or iron deficiency anemia. This patient is having which degree of burns? It's just an image based question, not a detailed topic. So this picture, remember, this is a very important 3rd degree burns. This patient has got electric shock, and this burn basically is a 3rd degree burn. Remember that. Imagine how painful it will be. Okay. This is a very important one. This skull of the baby, this is known as clover leaf shaped skull. This is known as clover leaf shaped skull. Now, exam entrance question number 1, where do you see clover leaf shaped skull? Now, clover leaf shaped skull, very important. Remember, so this is clover leaf. Such a beautiful picture. See this flower, this clover leaf, and the patient head also is like that, like a clover leaf. So clover leaf shaped skull, remember, very importantly, you see in FGFR1 gene mutation. FGFR1, FGFR2, and FGFR3. FGFR3 is also already an exam question, achondroplasia. FGFR3 gene mutation you see in achondroplasia. FGFR2 gene mutation you see in Cruzen syndrome. And FGFR1 gene mutation you see in Pfeiffer syndrome, and in Pfeiffer syndrome you have a cloverleaf shaped skull. Cloverleaf shaped skull. It's an image based question, remember that. Okay, so this part is done, and Pfeiffer, the P is silent in the Pfeiffer syndrome. Okay, this part is done. Okay, what else was the same patient only? This is the same patient who got a surgical correction done. His eyes are like that. So this again, very importantly, Pfeiffer syndrome. Pfeiffer, at least this image based question, this skull you should not forget. This is a proper cloverleaf shaped skull. Number 1. Number 2, the patient will have syndactyly. What is syndactyly? Fusion of the fingers. Dactyly means fingers, and syn means fusion. So fusion of the fingers is known as syndactyly. Like this picture, if you can appreciate this one, the 2 fingers are clubbed together. So this is syndactyly, fusion of the fingers. And the patient also has brachycephaly. Brachy means small, and cephaly means head. The patient will have a small head. So syndactyly, brachycephaly, all these are image based question for the Pfeiffer syndrome. Number 1. The patient also has broad thumbs. Now, there are 2 conditions where do you see broad thumbs. There are 2 conditions you see broad thumbs. Number 1, what you call Rubinstein-Tybee syndrome. There's a syndrome known as Rubinstein-Tybee syndrome, which we have done in the main videos. That patient also has a broad thumb, and this Pfeiffer syndrome also, the patient has a broad thumbs. Remember that. Same like microganetia. Tell me 2 syndromes associated with microganetia. Microganetia means small jaw. Micro means small, and ganetia means jaw. So in Pierre-Robin syndrome, in a case of Pierre-Robin syndrome, you will see microganetia, number 1. Number 2, in Treacher-Collins syndrome also. Treacher-Collins syndrome and Pierre-Robin syndrome, you will see microganetia. Okay. Remember, parents-teacher meeting, PTM. Parents-teacher meeting. Meeting means microganetia is seen in parents and teacher. The teacher is Treacher-Collins, Treacher, and parents for Pierre. Pierre-Robin syndrome, Treacher-Collins syndrome, you will have microganetia. Which neural tube defect is this? So this background, you can see this whole thing is already out, and even the head also is kind of flat. So this is nothing but encephalocele with anencephaly. Encephalocele with anencephaly. Encephalocele with anencephaly, that's what you see in this patient. This is a neural tube defect. Mother has not taken folic acid during pregnancy. Okay. Number 2, yes, this is the same patient only, flat anencephaly, like a flat head and background swelling, encephalocele. Okay, and this also we have done that multiple times. This also I've shown you this video multiple times. This patient has a, what do you think this patient has? If you can look at this picture very carefully, this patient has a single eye and no nose, a single eye and no nasal chamber. This is a case of holoprosencephaly. It's a case of holoprosencephaly. Exam entrance question number 1, is holoprosencephaly a neural tube defect? It is not a neural tube defect. It is a forebrain anomaly. It's not a neural tube defect. It's a proper exam question. Remember that. Okay, same 2 eyes clubbed together, 2 eyes fusing together. It is holoprosencephaly. Remember image based question, 2 eyes clubbed together. Remember this was 2 eyes clubbed to 1 eye, holoprosencephaly. Okay, yeah, this is also a nice question. A baby having some swelling over the lower back. So what do you call this? This is known as Spina Bifida cystica. This is known as Spina Bifida cystica. And Spina Bifida cystica means cystic swelling. Could be a case of meningocele or could be a case of myelomeningocele. So meningocele or myelomeningocele can happen. Either the spinal cord also can be there, or only the dura mater, arachnoid mater, pia mater is there. That will be confirmed by radiologically ultrasonography. So it's a case of Spina Bifida cystica. So this is a case of Spina Bifida cystica. Remember that. Okay, number 1. Number 2, very importantly, yeah. So this is kind of this is a ruptured meningomyelocele. This patient also had come to us. The patient had lower limb paralysis also. This was oozing out also. It was a painful life. So it's a ruptured meningomyelocele. Remember.